Okay, I'm here today with Amy Alvis. She is a PA at Bluefield Internal Medicine in Bluefield, Virginia, and she's here today to talk to us a little bit about what exactly a PA does and just some background and just give us some information about her career. Thank you for being here today, Amy.
Hey, Jenny, thanks for having me.
So tell us, first of all, what is a PA? What does that stand for? What is it?
A PA stands for a physician's assistant, and that boils down to we are considered like mid-level practitioners. We practice under the supervision of a physician, but we still are governed by the Board of Medicine. So we still practice like a regular doctor, just a little less schooling and time, and our restraints are a little bit different.
So tell us, what does a typical day look like for you?
Well, I do internal medicine. So internal medicine is kind of like your family doctor. So it's a outpatient clinic. We see adults. Internal medicine usually means adults. Family practice, they can do more children and adolescents. But here it's usually adults. Everybody comes in outpatient scheduled. And it's your typical everyday hypertension, diabetes, cholesterol, down to illnesses as well, sicknesses, and right now, of course, the COVID crisis.
Right, exactly, which is a challenge all in of itself. So tell our students what led you to this career path.
Well, originally I was a X-ray technology specialist. I did MRIs and I did X-rays, plain X-rays for a while. And I decided that I wanted to specialize more in hands-on medicine. So I thought about the DO route. And with the physician assistant, it was a little bit shorter of a time. You can also not have to just, I guess, stick to one specialty because I've done ER medicine before as well as geriatrics. So with this field, you can kind of float around a little bit and not necessarily have to specialize in one area like most of your MDs and such do. So that kind of made my decision to go the PA route.
So if a student was interested in this type of career, what do they need to do? What, as far as schooling, background, what do they need? What path should they take?
Well, most of it, and I'm assuming, it's been almost 20 years since I got out of school, but you have to have an undergrad. Most of them, mine, of course, was an X-ray as well as science. So most people either have a science background or biology or something like that. And then you'll pursue the physician's assistant track, which usually leads to a 3, sometimes 4, depending on your master's after an undergrad. It's kind of similar to the actual, DO route, but they go a lot longer, schooling, and then they'll do a residency, whereas ours is included in that 3-year.
Right. So tell our students, what is the most challenging thing about your job? If you can narrow it down to 1 or 2 things.
Most challenging, let me think. Well, right now it's all this craziness where you have to mask up every day. We are currently wearing masks, face shields with every patient, gowns. So I think 2020 did us under as far as that. I mean, you can't touch a patient without being head to toe covered in something. But typically, I don't know, most challenging is, I guess, the unknown when you get somebody you don't know what's going on. But most of this is, hands down. People come every couple months, normal stuff, blood pressure. So it's a slower pace than an ER or anywhere that you don't have time to think. These people are known to me. Most of mine I've had for years. So, but I think just the challenges recently in 2020 have been rough for us lately.
Absolutely. So tell them, what about some type of rewarding aspect of your job? What's something positive?
I'd say probably when you actually, you get to help people every day. So when you have somebody that, let's just say you've possibly caught breast cancer in or colon cancer. I had a lady the other day, she had abdominal pain. We didn't think much about it. She didn't want to go get screened. She finally did, and it ended up being colon cancer. And she came in here and she said, "Thank you for making me do that because I may not be here." They caught it early. It hadn't spread anywhere, and she was grateful. So knowing that people actually appreciate you helping them is the most, enjoyable thing about this. Of course, I like medicine. Medicine's interesting. So anybody that's interested in seeing diseases and sicknesses and illnesses, it's definitely a good path to take.
What advice would you give to high school students today, whether it's in the medical field, just any
Go
job?
to college. Go to college. You must go to college and do it. I mean, if you have any interest in, you know, something that's either it's medical, however, I know there's a lot of technical trades now that are also good, but college is definitely, I mean, it's nowadays you have to have some kind of background to do about anything. So I think, you know, get in there, start, and if, you know, you don't know right off the bat, complete the 4 years, and then you may change your role. That's kind of what I did. So are you still there? I'm sorry, you froze on me a second.
I'm still here. I think that's great advice for students. I want to thank you for sharing a little bit about your career, and we appreciate what you do. And we thank you for being here with us today.
Thank you. I appreciate you, Jenny. How many minutes was it?